Hi, I'm Eleanor Dungca. I'm currently as the lead professional for nursing, midwifery and allied health for education. So I am one of the internationally trained nurses as well back in the Philippines. And I have been in the UK for about 23 years now. So I've originally kind of like worked in the nursing home and worked in different fields of nursing. So I have done acute medicine and in the respiratory ward, and I've worked as well as a nurse practitioner out in the minor injury and illnesses. And I become clinical trial research nurse for the trust as well, that covers different specialty across the trust. Then I become the practice placement facilitator who supports all pre-registration students across different programs from nursing, midwifery and allied health as well. So further on, I progressed with my career as now as the lead professional. So currently we have kind of like number of nurses that we support in preparation for the OSCE program to kind of like enter the registry for the NMC. So I've kind of like support my team to what are the training programs we provide for them. We hire both locally and internationally. So for anyone who were recruited for international, they must have like CBT passed already, as well as the English test, either OBT or IELTS. So that is kind of like a prerequisite before they could come to the country. So they're only going to write the OSCE. But for international nurses, because they are within the UK, and we support as well that some student who's doing some masteral. So we got some student as well who's doing a top-up degree for adult nursing that come and start employment with us on a part-time basis. And then we help them to prepare for that one. But some of them might not have CBT or English exam. So they are in our pipeline as well to provide training for English. We work closely with our workforce team. So that side of like when they first arrive on within the UK, so we got some pastoral team to kind of like cater. So my colleague, in particularly from the workforce, help them to find, especially if they come from overseas, they have the first few months free of the accommodation, and if they are out of the vicinity, kind of like traveling from their accommodation to the hospital place of work, because we got 2 hospital sites. So we provide taxi for them as well. And then on the first few weeks, they kind of like have some food. And on their first week, we kind of like take turns within the community as well to kind of like introduce them where are the local areas. So for example, church, school, as well as like where you could buy things cheaper than they can afford for the first few months. So we do that as well. And then when they join our OSCE training program, part of our induction is we bring up some of the old international nurses from different community, because we are so diverse community really. So we try to bring each one representative from different areas just to kind of like signpost them for things. I'm fortunate within my practice education team because I follow them all the way through. So for us really, once they kind of like pass through our OSCE adaptation, so they are being followed through with our preceptorship as well. So our preceptorship promotes visibility, not only when they need it, but kind of like checking upon on them. And I myself go around as well. And for the trust itself, we have kind of like recently appointed what we call legacy mentor. So these are the mentor within the area that kind of like the idea is they are there for clinical support, not only when they are needed, but just kind of like reinforcing, thinking that how can we improve the rate for our retention really, because it's important for us, and just making sure that they come. And we actually are thinking of like gathering everyone together again that was past like the OSCE, as well as who's registrant now, just to kind of like see how they are coping within the community. So hopefully this summer we'll have some barbecue party for them.